There is no real known cause for testicular cancer. It's an unusual cancer. It's not very common. It's approximately 9 men per 100,000 in the United States today. So there's around 10,000 cases of testicular cancer in the United States a year. There are no predisposing causes. There's nothing that we know of that gives you a higher rate of testicular cancer, and it's a fairly infrequent cancer when you only have 10,000 cases in the United States a year. Typically it affects younger men, usually between 16 and 30, and interestingly there's a second peak of men that get this in their 60s. Like most cancers, early detection is the best way to have the best prognosis, and it's typically asymptomatic. If they feel a lump, they feel a nodule, they need to tell someone about it and not just ignore it and hope it goes away. Once it's identified, usually if we can get it at an early enough time, it's very treatable, and for the majority of men, somewhere around 98% of them, it's curable. So the predominant way of identifying it is testicular exam. Also, ultrasound is used in the early stages to see, is there something in the testicle, or are you feeling something that's not in the testicle? Once we've identified there's a problem with one of the testicles, then we would remove it. And there's an operation that takes about 15 to 20 minutes where the testicle is removed. Nobody wants it done. It's relatively painless. Recovery is relatively quick. So for the patients that have a testicle removed, if they're married, if they go and have children, the fertility rates are about the same as they are for normal patients. Maybe a skosh lower, but it's about the same. The follow-up consists of seeing their doctor, whether it be the urologist or the medical oncologist, on a regular basis to make sure that the disease doesn't come back. It's typically held that if you do not have a recurrence within 2 years, the probability of having a recurrence after that is very, very low. So it is treatable, it is curable, it's a relatively short period of time. The treatments can be as simple as just watching and making sure it doesn't come back, or it may be more involved needing radiation or chemotherapy.